Can imaging tests like CORT and MRI diagnose serous cystadenoma? Imagine trying to identify a tiny, delicate cluster of grapes inside the pancreas. That's what doctors often look for when diagnosing serous cystadenoma, a benign cystic tumor of the pancreas. Imaging tests like CORT scans and MRI are key tools in this process. They can reveal characteristic features that help doctors distinguish serous cystadenomas from other pancreatic cysts. On a CORT scan, serous cystadenomas usually appear as a multicystic, lobulated mass that resembles a bunch of grapes. The individual cysts are small, often less than 20 millimeters, and there are usually more than 6 of them. A hallmark feature is a central scar, which can sometimes show a stellate or star-shaped calcification. About 20% of these tumors have this scar, and it helps differentiate serous cystadenomas from other cystic lesions of the pancreas. However, the appearance can sometimes vary, and in some cases, they may look similar to other pancreatic masses, including solid tumors. This is why familiarity with their typical features is important for accurate diagnosis. MRI adds more detail, especially in showing the internal structure of the lesion. Serous cystadenomas tend to look like clusters of small cysts that are bright on T to weighted images and darker on T when weighted images. The central scar, if present, appears as a low signal area on T to images and may enhance with contrast during delayed phases. MRI is also useful in confirming whether the cysts communicate with the main pancreatic duct. This helps distinguish serous cystadenomas from other cystic tumors like branch duct intraductal papillary mucinous neoplasms, which often do communicate with the duct. While these imaging features are quite helpful, diagnosis can sometimes be tricky, especially in unusual cases. For example, a rare solid variant of serous cystadenoma might be mistaken for other types of tumors. When imaging alone isn't enough, doctors may use additional tools like endoscopic ultrasound with cyst fluid analysis to improve accuracy. In summary, CORT and MRI are the main imaging methods used to diagnose serous cystadenoma. They often provide enough information to make a confident diagnosis, especially when the lesion shows multiple small cysts with a central scar and no connection to the pancreatic duct. But because appearances can overlap with other cysts, doctors often combine imaging findings with clinical information and sometimes other tests to confirm the diagnosis. This is important because serous cystadenomas are benign and usually don't need surgery unless they cause symptoms. Accurate imaging helps avoid unnecessary procedures and ensures that more concerning lesions are treated appropriately. Always remember, if you or someone you know has a pancreatic cyst, consulting a healthcare professional is essential for personalized diagnosis and care.